Hi there, my name's Ian Panja. I'm one of the GP partners at the Malting Surgery in St Albans, and for the Training and Development Award I nominated Abbey Health PCN's training team. Now the reason for that is that it is an absolute marvel of collaboration, and I genuinely feel that working together in primary care is not always easy, but we've made it work, and it's because we've involved absolutely everyone. We've made use of the protected learning time that we have available to us, and everyone in the team, reception team members, paramedics, social prescribers, health coaches, doctors, nurses, you name it, we have worked together. So whether it's about a patient who has diabetes, everyone in that team has some learning around that and shares their own viewpoint. It's been an absolute joy, and the leadership has been exemplary, and I do hope it continues in the future.
I nominated Dolphin House as an exemplar for training, based on the fact that for well over 28 years it has been training year after year, not just medical students, not just GP trainees, but nurses at all levels, healthcare assistants, receptionists, and anybody else who wants support in training. Why do we do this? Simply because it helps our practice in our neighbourhood to stay stable and keeps the NHS in our area at the cutting edge. Along the way, we have trained somebody who came to us as an IT. He did healthcare assistant with us, then he did nurse associate, then he did full nursing. He stayed with us ever since. Even this year we've had 2 failing trainees who have been put on extensions. Both of them were passed with us and now work in the area, one of them with us. We believe that the best way to keep a GP practice stable is to keep training your workforce up. I feel Dolphin deserves this award to help encourage other practices to do the same.
Hi everyone, my name is Matt Charles and I'm the PCN manager for Stevenage South PCN, and I've recently nominated our PCN and PCN training team for the Award of Excellence in Training and Development. So as a PCN, we've always placed a lot of importance on training, learning and embedding this within our core processes and procedures for recruitment and ongoing staff development, closely linked to the DES contract and the Health Education England training roadmaps. Since the introduction of the PCN training teams last year, it's given us more time and capacity to further create and build a robust process of recruitment, embedding and retaining new staff, as well as continually supported existing staff through regular one-to-ones and annual appraisals. So based on these changes, I wanted to share a few examples of how this has benefited our staff, our practices, as well as the wider system. So we've recently introduced a new leadership and supervision structure for the organisation. So as well as providing every staff member with access to regular management and clinical supervision, we've also introduced group clinical supervision and case sharing to allow staff to share learning and receive insight from a wide range of clinical and non-clinical roles. In terms of internal progression, we've recently supported 2 clinical pharmacists to move into trainee advanced clinical practitioner roles. And we also have 3 clinical pharmacists and a paramedic currently undertaking their independent prescribing qualification. 2 of our original care coordinators have now become health and wellbeing coaches and PCN operations lead respectively. And in terms of system workforce development, we're involved in the learning organisation pathway for trainee GPs, nurses, physicians associates and non-clinical apprentices, providing a safe and effective learning environment as well as supporting NHS workforce development. These are all on top of the monthly target events which take place throughout the year, as well as a range of ad hoc training and development opportunities that staff access on a regular basis, both through the training hub and wider resources. So thank you for your consideration for our nomination, and we look forward to hearing the outcome of this process.